Hello, my name's Marissa Craig, and in my independent research project, I studied medical desert's influence on Northern Kentucky University student cardiopulmonary resuscitation, CPR education, and interest. So you might be thinking, what is a medical desert? The term medical desert is a recently developed concept. It was modeled from the term food desert. A medical desert is a certain area in which medical, behavioral, dental, and or pharmaceutical healthcare services are extremely limited or altogether unavailable. The creation of medical deserts can be attributed to many different factors, the main one being location, but other factors can also influence their growth and their severity. These include hospital funds, trauma center status, population, preventative care facilities, provider shortages, and even hospital closures and hospital funding. Just by being able to correctly define and identify areas of medical deserts could be extremely useful in healthcare. As we continue to identify and locate areas of medical deserts, different categories of the term seem to arise where different factors affect different locations differently. Categories of urbancy and rurality were created using the USDA's Modified Rural Urban Continuum Code. Based on this information, more accurate definitions of medical deserts can be created to best fit the needs of a specific location. The United States Census Bureau created differing categories of reality to help establish a need in certain communities that would then be able to help them better distribute medical supplies, procedures, employment, and even disperse funds and public health initiatives. These reports show which counties deserve the most government assistance to fund a variety of public resources. This information can also be used to identify which counties or locations are in need of the most help. Even though medical deserts can affect a lot of people's access to quality healthcare, medical deserts can be very hard to manage and control. Trauma incidents alone are one of the highest causes of morbidity in the United States. Using a cross sectional study of 2010 population rates, it's estimated that most of the population has limited access to level 1 or level 2 trauma center care within a 60-minute ambulance ride. This is really important to know during emergencies. Providing life-sustaining measures such as CPR or aspects of first aid before emergency services can arrive can be imperative to survival, especially in areas like medical deserts where emergency services may be limited or altogether unavailable. Victims who received bystander CPR within the first 10 minutes of unconsciousness had increased their survival rates 4 times compared to those who did not. The knowledge of CPR and first aid could really help band the gap in patient education in medical deserts. The truth of the matter is, medical deserts will probably always be around. The most important aspect to fight medical deserts is patient education and healthcare literacy. If patients understand the importance of their preventative care services like their yearly checkups, cancer screenings, and things like that, it can prevent further healthcare issues down the road. Also, patient education, such as knowing proper techniques, hygiene, CPR, and first aid, can also become life saving in certain situations. Kentucky has the seventh highest number of deaths due to heart disease in the United States and is in the bottom 10th percentile of ranking in CPR education, which is a very dangerous combination. Being aware of Kentucky's low rankings, certain programs have been implemented in hopes of improving their numbers. Northern Kentucky University has received grant funding to participate in the Heart Savers program, which teaches and certifies CPR and first aid skills free of charge to students and members of the community through the American Heart Association. The term medical desert is a newly created concept, so there is a lack in academic and scholarly articles about them and how they affect different communities. Currently, there is only one governmentally accepted definition of medical deserts, which can be dangerous considering that definition doesn't apply to all different areas. Not many articles studying the effects of medical deserts exist, but some similar evidence based studies have been conducted in Europe in an effort to help reduce healthcare inequalities, including medical deserts. The only true defining research of medical deserts that I found within the United States was conducted by a PhD student as his thesis at the County School of Public Health, in which he tried to define the term urban medical deserts. This created the idea of different concepts, categories, and definitions of the term medical deserts. So, my research goals were to identify and assess the impact of contributing factors of medical deserts to better identify them, and how can we encourage patients to increase their healthcare literacy and patient education. A total of 20 Northern Kentucky University students volunteered to complete the survey entitled Medical Desert's Effect on Varying Populations, which consisted of 30 multiple choice questions and some open response questions. Students were encouraged to complete the surveys in SONA, in which a SONA credit would be rewarded towards their Psych 100 grade, or they completed the survey voluntarily. To participate in the study, participants must have been 18 years of age or older and attending Northern Kentucky University. To complete the survey, individuals must have had access to the internet on a computer or mobile device and an active participant SONA research portal account through Northern Kentucky University. The survey was constructed through Qualtrics and consisted of questions related to students' demographics, location, patient experience, distance to medical facilities, and personal opinions. Some of the following questions were included. So the participants were asked, to the best of your ability, define the term medical desert. This question prompts them to think about the term medical desert and try to define it. Another question asked was, as a child, 18 and younger, what was the average distance to the following medical facilities? This prompts the participant to think about how far away they are from certain medical facilities, maybe making them try to understand if they did or did not live in a medical desert. So the next question is kind of the leading question. We asked the participants, is knowing aspects of CPR and first aid an important skill to know? If they answered agree or strongly agree, we would think that they might also answer positively towards would you like to receive more information to receiving a CPR training? The next question is, in what percentile do you think Kentucky falls in the ranking of CPR education according to American Health Rankings annual report? We asked this question to see what students think Kentucky rankings is versus what they actually are. Other variety of questions were asked that also related to their patient experience and personal opinions about certain healthcare topics. The main goal of the survey was to prompt the participants to think about their healthcare experiences and maybe get them to be interested in learning more about medical deserts or interested in furthering their patient education or healthcare literacy. A one sample t-test was used to measure participants' estimated percentile that Kentucky falls in ranking of CPR education according to the American Health Rankings annual report. A Chai Goodness of Fit test was used to analyze participants' distance from certain medical facilities and services, such as a hospital. Participants' living location was asked to determine distance from certain medical services to distinguish whether or not they might live in a medical desert area. Distance to hospital services showed a statistical significance as there is a disproportionate number of individuals who live less than 10 miles away from hospital care. A one sample T test was used to measure participants' estimated percentile that Kentucky falls in ranking of CPR education according to the American Health Rankings annual report. While the correct answer was less than 10%, the standard deviation of their guesses was 11.9, and the mean guess was 28.85. Also, while 100% of the participants agreed that CPR and first aid skills are an important skill to know, only 35% of participants said that they would be interested in obtaining a free CPR certificate from Northern Kentucky University's HeartSaver program. This figure shows the data from participants living distance to hospital care from student home location. As you can see, 11 participants lived less than 10 miles away from a hospital location, and that represented 55% of the population. 5 individuals represented that they live less than 20 miles away from hospital services. 3 individuals identified that they live less than 30 miles away from hospital services, and 1 individual identified that they live 30 miles or more away from hospital services. This result was somewhat expected as Northern Kentucky University is in a very urban area. It is also interesting to see other locations, such as more than 30 miles away, as maybe during the COVID pandemic, more students are accessing learning materials through home or living at home. The intent of this study was to force participants of different background locations to think about certain questions regarding their healthcare experiences, to encourage them to want to improve their own healthcare literacy and patient education. Participants acknowledging what a medical desert is and whether or not they live in one could help them personally better recognize the importance of healthcare aspects such as CPR, first aid, and even preventative care. Even though the findings for Northern Kentucky University show that a statistically significant amount of students live less than 10 miles away from hospital care, this does not minimize the significant impact of knowing CPR and first aid. Victims who received bystander CPR within the first 10 minutes of unconsciousness had increased their survival rate 4 times compared to those who did not. Despite only 35% of participants being interested in obtaining a free CPR certification from Northern Kentucky University's HeartSaver program, this is still an important skill to learn and should be advocated for in future programs. Further defining and categorizing medical deserts could help establish a need in certain communities that could assist government funding, public health initiatives, and even patient education programs. In certain regions, large gaps of care often allow illnesses to go unnoticed or unattended, increasing chronic illnesses and diseases, which can also intensify morbidity rates. Even though there are similar studies conducted across the world in medical insecurities and medical inequalities, not many studies focus on medical deserts and their impact on certain communities. In future research opportunities, the government should take initiatives to study medical deserts and their different impacts on different cities, populations, and demographics. There were many limitations within this study, one being that all participants must have been a Northern Kentucky University student. Another limitation being that most of the students who took this survey were in a Psych 100 class. Maybe if different majors or different variety of majors would have taken this survey, more people would have been interested, such as if we focused more on pre-med or biology majors. Another limitation of this study was that it was conducted on Northern Kentucky University's SONA application. This means that only students who have an active account can participate in this study. This mostly includes Psych 100 students, as they are required to take some surveys for their class. The main limitations of this study include timing and sample size. To accurately be able to study the effects of medical deserts on certain communities, you would need to gather data for multiple years over a large sample size. As advancements in research efforts are made, in future studies, I hope to see medical deserts become better categorized and defined. In future studies, they should include looking in different locations, different populations, and different demographics.